Now, community X, community Y. More false positives are found in community X. What is your inference? So you should remember, doctor, false positives, true negatives, how do you calculate? Very common question in the exam. 1 minus specificity into 1 minus prevalence is false positives. Specificity into 1 minus prevalence is equal to true negatives. And these are the two things. That's the reason. Prevalence and false positives are very much related to each other. Argemone oil. It is a nitric acid test which is very, very important to identify the adulteration. Strepto, E. coli, Clostridium, they are all indicators of the fecal pollution. Now give me an answer, doctor. Shoot an answer. Charcoal, yeast extract, agar buffered with cysteine and iron. Which organism comes to your mind? Charcoal, yeast extract, agar. No big deal. Microbiology, first time are you listening? No problem. If you take any small entrance book, 20 plates, 20 agars, totally 300 facts to be remembered in microbiology. That's all. If you have never read also, you can read now. Legionella is an answer shouted by everybody, which is true. Now, doctor, HIV transmission, typically when does it occur? Commonly, you know how carefully to put needle, IV needle into a HIV patient. That time nothing happens. But while you are removing the needle, you won't be that careful and that will prick you. So, recapping the needle is a common reason. Corpulence index is basically obesity measurement. Ponderal index, corpulence index, Broca's index. Okay? Now, 14-year-old boy shoplifting. What's wrong? So, the boy will be sent where? Remand home. For what? For getting trained in how to shoot bombs. So, there is a better training. Why small shoplifting? Now, saturated fatty acids include everything, but not oleic acid. Lepramin test is not diagnostic. Everyone knows that. It is only prognostic. Now, anti-larval measures. Gambusia affinis will eat the larvae. Paris green will make the larvae die. Intermittent irrigation is another method. So, if you don't get seed, you can also become a good farmer, buy some nice land and grow paddy so that people get diabetes after eating the rice grown by you. And then once more you will have patients. With MBBS only you know how to treat diabetes. So, that is the entire food cycle. What is steps? Surveillance of risk factors of non-communicable diseases is basically called the steps, which is an instrument. Vegetable fats versus animal fat. What is the main difference? So, fundamentally it is the fat soluble vitamin content which is different between the two. Vegetable oils are more rich in EPA, which are less atherogenic, and animal fats are more rich in fat soluble vitamins is what need to be understood. Okay, doc. This you need to give one confident answer. Thayer-Martin medium, have you heard? If you didn't hear, no problem. You can go through the videos in the microbiology. VPN. We use 3 antibiotics in the Thayer-Martin medium. Out of the 3, which is the one which is responsible for killing gram-negative organisms? One antibiotic will kill fungi, one will kill gram-negative, other will kill gram-positive, only Neisseria will grow. That is the purpose of Thayer-Martin medium, which will bring the selectivity to the medium. Which component? No, we know that gonococcus is grown, that's right. But my question is, out of the 3 antibiotics, I don't know what is V, what is P, what is N, I think you know that. Which one inhibits the gram-negative organisms? Who will give me correct answer? Varangal says N. We don't know what is N. P is what is proposed by Guntur and Dr. Navya. P for what? Okay, anybody can tell me? N for novobiosine was a guess by Tirupati people. See, doctor, Thayer Martin. Today only I came to know this, to frame a question for you. I had been teaching microbiology since many years. Suddenly I found today, Thayer Martin, mein so many components are there, they kill specifically each of them. Very good question for this evening. Otherwise I too don't know. V is vancomycin. It inhibits gram-positive organisms. P is polymyxin, which inhibits gram-negative. N is nystatin, which inhibits fungi. So that ultimately only Neisseria will be growing. That's what you need to remember about Thayer Martin medium. That's good. Now 37 weeks, came to the PHC. She didn't take any TT earlier. What is the recommendation? Minimum 2 TTs must be given 4 weeks apart. Is the minimum thing that you need to do for a pregnant woman to prevent the neonatal tetanus. Propionic acid 2% is a good fungicide. Aedes aegypti risk won't be there if the index is below 1%. Coming to the leprosy, how do you define a defaulter? 3 months, 2 months, 6 months? So you must know the definitions of TB and leprosy. Now, nodular hepatomegaly is a feature of everything but not the biliary cirrhosis. In Turner, you have a short stature, infantilism, and external genitalia abnormal but not retinitis pigmentosa. I'll try to run faster because we have once more Sunday. Another 240 loaded question paper ready for us to answer. And tomorrow I welcome you all. Evening 5 to 8 we will have a quick review session of ophthalmology. We'll have it for tomorrow, day after tomorrow. In 2 days, 6 hours we will iron out everything about ophthal. Those who are good listeners, you're all welcome. So that even I am restless the next 8 weeks. Unless every day I am surrounded by students, every day we are studying, then only I can be able to hold myself until November 18. So you also join. If you entire morning you read well, evening hang up to a internet anywhere, enter the same username password given to you, and then you can log in. We will have some questions and common issues. Quick 6 hours mein how to revise ophthalmology. The National Ophthalmology Society will ban me. But 6 hours mein, now it is all about 4 hours में कैसे पढ़ना, 2 घंटे में कैसे पढ़ना जनरल मेडिसिन को. More comprehensive you are, chances of succeeding are more. Okay, doc. Congenital syphilis, typically lymphadenopathy is one of the early features. If you look at the renal disease, there is no correlation between that of the severity of the proteinuria and the severity of the responsible renal disease. There can be a minimal change disease with a significant proteinuria. There can be a very severe pathology in the glomerulus and there may not be any proteinuria. So that's the reason there is no relationship. Coming to carcinoid, we don't do vinyl mandelic acid, which is done basically in FEO. Recurrent syncopes are the part of autonomic neuropathy of Scheidegger. What is Scheidegger? Parkinsonism plus autonomic nervous system dysfunction. Combination is called Scheidegger. Then Stokes-Adams also will lead to syncope, but not narcolepsy. What is meant by narcolepsy? Suddenly the people will be falling into episodes of sleeping because of the sudden intrusion of the REM into NREM is basically the problem of narcolepsy. Now, hepatic insufficiency lead to changes in EEG, but they are not diagnostic, they are very non-specific. Okay, shoot me an answer, doctor. This everybody will answer, I know. Which organism is an aerobe which is seen in burn wounds, nosocomial pneumonias and cystic fibrosis? Confident answer. Right or wrong? Very good, we have 45 viewers. Pseudomonas. Our Guntur students aggressively are answering it. Pseudomonas aeruginosa. Now coming to corticosteroids. It leads to collagen loss, skin can develop fragility. Avascular necrosis of the bone, it can lead to it can decrease the leukocyte migration, everything is possible. Do you have an opening snap in aortic regurgitation? No. What do you have? The aortic regurgitation, two classical auscultatory features which you are not going to forget. Early diastolic murmur, which is more or less like your respiratory sound, lump, lump, like a whisper. And a mid-diastolic murmur, which is like Austin Flint murmur. In severe AR, they are the two classical murmurs of the AR which you should not basically forget. Can MR cause snap? Most often it is the MS who is expected to cause a snap, opening snap. MR causes pansystolic murmur, MS causes MDM. And MDM will show presystolic accentuation until atrial fibrillation doesn't develop. And ejection systolic murmur in AS. Alveolar heart disease is nothing, doctor. There are 4 valves, 2 possibilities, either stenosis or regurgitation. Just like some people read excessively, some people don't read, have resistance to study. Both are abnormal. Now, Paediatrics lead to hypercalcemia, which lead to development of nephrolithiasis. In Hodgkin's, typically CMI get affected, cell-mediated immunity, hence delayed hypersensitivity reaction is abnormal. There can be hemolytic anemia and eosinophilia. These are all very much possible. Now, in hepatic cirrhosis, childhood onset hepatic cirrhosis, where can you possibly see it? Celiac disease is one of the important implicated condition. Gotches relatively leads to cirrhosis in the by the time the individual reaches 15 to 20. For the penicillamine therapy, we use in all the given conditions but not in polychondritis. Now tell me, doctor, 3 organisms obligate intracellular organisms. What is the meaning of it? Unless they go to father-in-law's place and stay inside the bedroom, they can't survive. So, which are those obligate intracellular organisms? Who is going to tell me? Very good. Chlamydia, Mycoplasma, Rickettsia. We are getting wonderful answers from Dr. Varun, Sudha, Deepthi, everyone is answering. That's good, doctor. Rickettsia, Chlamydia. These are the 2 things you should remember. They can't make their own ATP. Mama ji aake khilana hai. They stay inside the cell where it is really cool, is the way to remember Rickettsia and Chlamydia.